I'm Dr Sohail Munshi. I've been a GP in Manchester for 23 years, and I'm now the Chief Medical Officer of Manchester Local Care Organisation. It's our aim to integrate care to improve the health and well-being of local people. Firstly, are you sitting comfortably? Great. But also not so great. Do you find yourself sitting still a lot? Because that's exactly what I'm here to talk to you about. Phones, social media, TVs, box sets, laptops and video games keep us all sitting still for far too long. Add this to the time we spend at our desks, at work or school, and suddenly we're spending the majority of our days sat still. The thing is, our bodies are meant to be active, outdoors moving around and getting fresh air, not sat still indoors for hours on end. But modern life is making getting out and moving about more difficult. And as a result, more than 1 in 4 of us do less than 30 minutes of activity a week, when we should be doing at least 30 minutes a day. But less than 2/3 of us know this. As you'll know, inactivity can cause numerous health issues, while being physically active can significantly reduce the risks of developing health conditions and can help manage them better. So it's really important to encourage and enable patients to move more, to improve their mental and physical health. The problem is, not enough of us enjoy physical activity. But what many people might not realise is that it can take many forms. It doesn't have to be about signing up to a gym, wearing head-to-toe lycra, or running for miles. It can be as simple as swapping everyday activities for ones that get us moving more. For example, suggest patients swap the lift for taking the stairs. Suggest they get off a stop earlier on their commute to work or school. Encourage them to try some armchair aerobics. Or take some time each day to go for a short walk. Or even squeeze in some squats while they watch their latest box set series. If they might struggle to spare half an hour, they could break it up into 10-minute chunks. Or you could even suggest 30 moves or 30 stretches. It all counts towards getting in that all-important 30 minutes of activity a day. And the best bit is that changes like these will feel small, but the benefits will be noticeable. Encouraging patients to move more is beneficial to you and your practice too. It helps prevent long-term illnesses, and by suggesting activities that are social, you can help reduce loneliness and isolation in the community too. Enabling patients to do 30 minutes of activity a day is a challenge. The good news is that 2/3 of us want to be more active than we already are. And in Greater Manchester, we're getting more active 3 times faster than the national average. But there's still more we can and need to do to get more of Greater Manchester moving. So don't just sit back and wait for your patients to ask the questions. Stand up for their health. Help them recognise the amount of time they spend sitting still, sucked in by a new series or social feeds, and encourage them to get up, get moving and get on their way to totting up those 30 minutes a day. For more tips on how to help patients get their 30 in, visit thatcounts.co.uk.